you don't know what the complication will you face in your future while going throughout this journey in the 9 months period. So financially, then emotionally, then apart from this, sometimes the male and the female partners, they are having some issues like diabetes or hypertension, or they need to be treated first. Then only you plan for the pregnancy. And BMI, if the patient is very obese and BMI is more than 25, then she needs to work on herself first, then you plan for pregnancy. If suppose male partner is having some issues, some surgical issues are there, varicocele or hydrocele, that need to be treated. Then apart from this, some genetic issues are there. That genetic karyotyping should be done if you have some family history of this sort, and they are very simple blood tests. But if you get it done, then you can come to know that this genetic issue will not come in my child. So these all facilities are available nowadays, especially rubella vaccine is there. Suppose you get the rubella infection during the pregnancy, so you have to terminate the baby. Because why is it so? Because it has many congenital malformations in the baby. It causes many congenital malformations in the baby, which doesn't survive properly, or if survive, there are a lot of complications. So nowadays, rubella vaccine is available. So earlier it was given 3 months before you plan for the pregnancy, but nowadays it's like even 1 month before you can plan. It's a viral vaccine. So don't plan for the pregnancy. There should be a minimum gap of 1 month. And so main things we can conclude that you have to start some folic acid to avoid the brain disorders in the baby. And you can say vitamins, multi-fiber rich diet, many nutritional things need to be discussed. Then health issues of both partners, genetic issues, financial, emotional. So there should be availability to the doctor. Suppose you are working and you are staying in some remote areas and you are not having any approach to the doctor, then like you should have all these things in your mind, and then you should plan for the pregnancy. Every patient is different. What patient needs what, that your doctor will tell you, guide you after examining you and according to your requirements. Then you should get a sonography done. You should get the blood test done. Blood test, especially of the blood group, because if a mother is having blood group negative and husband is having positive, then we have to take extra precautions. We have to get the blood test done, and especially after, if suppose this baby's blood group is positive, so we have to give the NTD, that is so that the next baby doesn't suffer from that issues because of the ABOH incompatibility. This is called blood group incompatibility of the partners. This is important. You should work on your thyroid, on your diabetes, on your hypertension if you are having this sort of issues, because thyroid also causes the congenital malformations, then diabetes and hypertension. These all should be controlled properly. Your BMI should be within the range of 18.5 to 24.9. Like roughly you can say 18 to 25. Then your age. Sometimes many working couples, they come and ask, ma'am, how long we can wait that we don't want pregnancy. Then I suggest them according to their age. It's always better that you plan properly and you don't spoil your career too. So these factors are very important. Genetic testing, sonography, blood testing, your semen analysis is normal. You should not take excess of smoking, alcohol, because these all things are going to affect your quality of sperm and eggs, and they are the main reasons for the good pregnancy, right? So but patients, when they come to the doctor, they take it lightly. That what ma'am is saying, no, but they are very important. So because they are ultimately producing the oxidants in your body, and they are spoiling the quality of egg and sperm, which is your main target. You don't want your baby to be suffered the whole life. Please avoid smoking, alcohol, take healthy diet, control all your diabetes, hypertension, thyroid. Like, you are going for a new venture. So everything should be normal as far as possible regarding your physical, your mental, your financial health. Discuss with your doctor and don't do. You should not take these things. And sometimes the patients are taking skin treatment or other treatments. So always, at least 3 months prior, you plan the pregnancy. You discuss with your doctor, gynecologist, that these treatment I am taking, are they safe or not? Because retinoids and all, which we are taking for the skin treatment, they are not safe. Ideally, they should be stopped 3 months prior you plan the pregnancy. There are many other drugs. So you have to be very clarify your mind, because don't think that once you will get pregnant, then you will go to the doctor. Because before the pregnancy, what is happening? Fertilization. And fertilization period, if it is safe and any harmful drug is not affecting that period, that means it will be a good baby. And even post fertilization period, till your pregnancy test comes positive, and even after that, after the pregnancy test positive, then we go for the sonography till the cardiac activity comes. So all these things, I want to say preconception 3 months to till the baby is delivered. So please don't do any sort of the things. Don't take any medications which are harmful for your baby without consulting your doctor. Even if you are suffering from a simple fever or whatever. So ask for the doctor that what are the safe drugs, I will go for that. And there are always alternatives. If some psychiatric patients or suffering from liver disease, any issues, cardiac, epilepsy, any problem they are facing, we have alternatives. Everything we have alternatives. But the thing is, we have to go to the doctor, we have to discuss, and you tell them that, sir or ma'am, we are planning for the pregnancy after 2 to 3 months. So please change the medication accordingly. And what things should be done or must be done? Take healthy diet, because they have a healthy fiber-rich diet. Avoid papaya and pineapple. They are they are having enzymes which have been proven that they cause abortion or decreases the fertility. So at least when you get pregnant, try to avoid these papaya and pineapple when you get pregnant. And take a healthy lifestyle, reduce your weight accordingly, control your diabetes, don't take excessive salt, take proper liquids, and liquid means I want healthy liquids, coconut water and all these. Don't take, sometimes, yeah, one more thing I want to cover, that people say glucose is good. No, this is not at all good. Please don't take whenever you feel low or low energized. Take proper food.